And, listening to that first Bon Iver album was something that I guess I discovered during a really painful emotional time in my life. And sort of whenever I feel vulnerable like that, I tend to go back to that music, and it sort of brings me back right to that place and all of those memories that, listening to Flume and Skinny Love and those songs just kind of take me right back there. And so I think in some ways the music that affects us is also really connected to all of the associations, be it smells, memories, the characters we were with that are connected to those pieces of music.
I wear my garment so it shows. Now you know. Only love is on the room. Bluey feathers on the floor. Sky is warm, she's the moon.
Welcome to This Broken Mixtape, the podcast that rewinds and presses play on the soundtrack to your life. I'm Jeff Wu.
And I'm Justin Lee.
Dr. Chayim Newman is a clinical psychologist that uses various therapeutic methods to treat difficulties with anxiety and stress, mood and depression, relationships, chronic or stress-related medical illness, and other psychological/emotional issues. With over 2 decades of experience as a touring performer, event producer, and artist liaison, he has a first-hand understanding of the unique challenges and stresses facing musicians and high-profile individuals. We sat down with Dr. Newman to discuss the series of events that led him to counsel musicians, why we tend to listen to depressing music when we're in our feelings, and what's really going on inside Kanye's head.
This week on the show, our special guest is Dr. Chayim Newman. Welcome to the show.
Nice to be here.
So you are a psychologist to musicians. One thing that we'd like to know is why you decided to pursue psychology.
So that's a good question. I think it's something that I think about a lot as I go through my career and all the different sort of paths I could have ended up on. I was thinking about it today, and I think there are probably 3 components of how I ended up becoming a psychologist. And they're sort of this. When I was a young kid growing up in Toronto, it really, like age 6, 7, 8, I think my favorite thing in the world was doing puzzles. And I would spend countless hours on my parents' floor. It was like every coffee table in the house was covered with a puzzle at some sort of varying degrees of completion. And it always fascinated me. And I was always sort of engaged in puzzle books of one sort or another. And, I think human experience is kind of the ultimate puzzle in trying to understand what makes people tick and what are the components of experience and how we deal with, as unique individuals, with the things that life throws at us. And so, psychology essentially is the attempt to understand the puzzle of human experience. And so sort of that's one aspect. I think a second aspect is during my youth, probably between ages maybe 14 to, let's say, 22, I probably lost about 6 close friends, suicide, drug overdose, car accidents, really a lot of tragic circumstances. And I think as a kid and as a teenager, trying to process those experiences and make sense of the things that I was seeing around me in my own life, led me to start to read a lot of philosophy books. And I was like an only 14-year-old kid. I knew reading, Hermann Hesse's The Glass Bead Game and, old Thich Nhat Hanh books, and trying to sort of understand the bigger picture of life and purpose and mortality and things like that. And I think philosophy ultimately led me to psychology, and sort of from understanding the big picture experience of human experience to understanding, well, how is my experience look? So that was kind of a second piece of how I think overall psychology fascinated me. And then growing up, both my parents are very involved in, and I guess you could say like helping fields. My mom's a social worker, And my dad, aside from his day job, his basic hobby is community activism. And our home was always kind of a destination that people who were suffering or struggling in one way or another, who had experienced loss, grief, turmoil in their life, somehow would end up on our doorstep, pouring their heart out to one of my parents and receiving some amount of support and empathy and whatever logistical help they could to get back on their feet. And so I think that inspired me on some level. And I always grew up in a world where the values were built around empathy and doing what you could to alleviate suffering. And so psychology, which sort of was both the puzzle aspect and the empathic aspect of making a difference and helping people who are struggling, really was kind of the natural fit for me, I think.
And then narrowing in on that, most of your patients are musicians. So how did that come to be? Was that something that you were actively seeking, or did it just kind of happen serendipitously?
So do you want the short answer, or do you want the
give us the long
backstory?
Answer. Yeah, give us the backstory.
So the backstory is really interesting. It kind of actually entails how I stumbled onto the music world at all, as it were. And so growing up in the traditional Jewish world in Toronto, one of the things you do is post high school, you take a gap year overseas in the Middle East to sort of study your traditions. And, some people really immerse themselves in the study and the history and the spirituality. I mostly went out and got drunk and chased girls and looked for rock and roll. And I stumbled onto a small community out there. It's actually a really fascinating place outside of the third biggest town in Israel, which is a town called Modi'in. And in a little suburb there's a small community of former hippies, all of whom had moved from San Francisco in the 60s and 70s and ended up in this small, almost like commune. And I kind of stumbled onto this place, fell in love with it. It was the first time that I really started to seriously listen to the Grateful Dead, was inspired by those people. And the people in the community that were my age. So at the time when I was out there, I graduated high school a bit young. So I was about 17 in my gap year post high school. And the people in my age range, so sort of between 15 and 22, were all these like perfect, beautiful looking flower children. Every one of them could have been like an Abercrombie model. All of them were super musical. Everybody where they were like multi-instrumentalists. You had sort of kids that looked like, young Roger Daltrey and, young Bobby Weir. And they were all artists and had bands that played locally and toured around the country and were fairly well known. And these were 16, 17, 18-year-old kids who were achieving a ton of success, just making kind of cool music. And I ended up hanging out around this crew. And I think that was my first experience around artists. And I was just like, wow, like these people are amazing. Like that's what I want to be like, which was sort of like my first foray into the artist world and seeing what their life was like behind the scenes. When I came back to Toronto and eventually went to U of T to do my undergrad. So one of the things I would do is I started to get involved in bringing bands like that over from overseas to perform in Toronto at various venues around the city, places like the Opera House, the old Comfort Zone, and sort of, kind of squalid, fun venues like that. And kind of loved being just around artists and around the music scene. As I got a little older, started to play music myself, ended up forming this kind of 9-piece fusion funk band, which was basically composed of 8 really, really top-level musicians, many of whom play in other acts around Toronto, and then me. And I always said that my greatest talent in that band was surrounding myself with people who actually had musical talent. And I sort of, I guess, carried myself on a little charisma and a lot of their coattails. And so did that for a couple of years. And then kind of at some point along that road, realized that my lack of musical talent was probably going to limit me from actually being able to be a performer as a career. And so that was great. I was kind of cool with that. Did some other stuff in the music world. Ended up doing a lot of artist relations work at various big music festivals, Governor's Ball, places like that. Had a really great experience. First time being exposed to working with sort of upper echelon A-list artists and, doing dressing rooms and stages for headliners and that kind of thing. And at the same time was pursuing my career in psychology and doing my master's degree and my PhD. And then at some point, I think I I think I actually had a period where I became very disenfranchised with the music world, not because of the artists, but because of getting to see a little bit of the sort of the underbelly of the business of the music world and some of the greed and the corruption and, like there is in every industry in the world. And I had such this naive idealism about it was all about the music and the artists and the experience and the scene. And, never thinking about all the people that were profiting from it and how they were taking advantage of perhaps many of the artists, or how artists were being pushed in unhealthy ways along that process in order to serve someone else's interest. So I actually, it really burst a bubble for me when I saw that. And for a couple of years, sort of took a step back from the music world and really said, maybe I don't want to be involved in this. Poured myself into my PhD, was working with cancer patients and pretty intense sort of suffering populations out in New York City. Had a really, really meaningful time. And when I completed my PhD and then my hospital residency and sort of became Dr. Newman and began to work in Toronto, which is home for me, I got a phone call from a buddy of mine who was Toronto-based and now manages a bunch of acts out in LA, and said, "Hey, I know you're in private practice and seeing patients. Would you see an artist of mine who's struggling with some issues and trying to get an album done for his record label and is kind of having a hard time doing it because of what's going on in terms of mental health and some emotional struggles?" And I said, sure. And I began to work with this one artist. And it was just like, it was like that proverbial sort of smack in the side of the head where it's like, well, duh, here's the two things that I love, right? And sort of being around artists and being around the music world and being able to make a difference. And I had already slept on tour buses, toured as an artist, been in the scene at festivals and working at concerts, promoted shows. And so I understood what the artist experience was like. And then at the same time, had the depth of clinical training and understood how to work with various psychological issues, diagnoses, and how to help people along their road. And it was sort of like the seamless fusion of those two things. And, one patient led to another, led to a third, led to a fourth. And, in some ways, I almost feel like, for me, going to work is not really going to work. It's just kind of doing the thing I love with the people that I care about every day.
Mm-hmm. Have you ever been in a situation where you've taken on a new patient and you were already familiar or even a fan of their music?
Yeah, so it's funny, we're always very conscious in the psychology world about conflicts of interest, right? Mm-hmm. So I wouldn't sort of see a family member as a patient or a close friend. And I've had once so far that issue where I was actually kind of a fan of the artist. And I think that's where, they say for psychologists, so much of the work is the self-reflective work. Often it comes from the mindfulness or meditative traditions about being able to watch your own reactions in a moment and understand what's coming up for you emotionally as you're working with a client or a patient. And so I think with that individual early on, much of what I had to do was, kind of constantly reminding myself, this is not this person's stage name. This is this person as human being. And, all human beings have the capacity to suffer, and all human beings have the capacity to experience joy and to feel balanced. And my mission and my purpose and my raison d'etre here is to help this human being who is experiencing suffering feel less suffering and more happiness. And I think in the end, the truth is that's probably what artists appreciate, is on some level, someone who understands their experience, but who also isn't viewing them just as an artist and is able to say like, oh, there's like kind of a human being somewhere in there, and let's just relate to you on that level, which I think they probably don't get. And especially, sort of the more successful they get in their careers, the less they get of people seeing them just kind of as that human being.
In terms of just, commonalities, in treating all these different musicians, have you noticed a lot of, recurring issues that musicians have? I mean, I think like there's those stereotypes of like sort of the starving, artist who bleeds for the work and really like can only write when they experience true pain. And We've seen so many like VH1 behind the music specials where, you know, it at this point, it's just kind of like a joke, right? But I mean, you actually firsthand witness all these things. So tell us some of the issues that you regularly deal with your patients.
So I'll say two things. I'll tell you a little bit conceptually about that, and maybe, you know, sort of some of the evidence, and then in the end I'll sort of give you the anecdotal piece from some of the people I've worked with. You know, conceptually, in the end, human experience is human experience, right? And sort of depression is depression, and you can experience it if you're an artist, you can experience it if you're a bus driver, you can experience it if you're a homemaker. And I'd say that, you know, the fundamental problems that I'll typically see, which are things like depression, anxiety disorders, addiction, stress and stress-related issues, relationship problems, you know, those things they're not endemic to artists. They're sort of endemic to human beings. And so I see plenty of what I see in artists of what I had seen in patients that were non-artist lay populations. But I think the way it manifests in artists is a little bit different, and certainly depending on the stage of career of an artist or the level of artist I'm working with. And so, you know, sometimes when you're working with artists who are just starting out, it's like their level of the nature of their stress is, you know, working 24 hours a day trying to push their music, trying to get that break, trying to get someone to notice them, trying to produce that thing that's going to finally allow them to get some traction in the market. And maybe the way that impacts their relationships is that while they're home, they're sort of neglecting the person next to them because they're so focused on that singular, most difficult piece of like finally of making your first inroad, which is always the most challenging part, right, of an artist's career. And so, you know, I'll see a lot of that kind of stress with young artists just starting out. Whereas with established or really successful, and I'm working with, let's say, arena acts, you know, the stress is not being able to go anywhere and have peace of mind because everywhere you go, you're just bombarded with, you know, people sort of hounding you to take a selfie with them. And the relationships are impacted, not so much in the neglect way, but in the fact that, well, like, first of all, you lack stability if you're on the road 240 days a year, right, on an album cycle. Makes it much harder to maintain your relationships in a stable way. And then also, I think in the genesis of relationships, the bigger you become as an act and the more, you know, fame, so to speak, that you have, well, like, the harder it is to really know that anybody actually genuinely wants to relate to you as a human being and not you as, you know, your Instagram handle and how much street cred you have. And so, you know, that old saying, it's lonely at the top. So I've really seen a lot of that. Like, the bigger the artists I work with, the more lonely and isolated they feel, and the more their relationships are always sort of come with a bit of a paranoia or a caveat of like, when am I going to find out that this person just wants something from me? And so they struggle in that way, and that loneliness often kind of feeds depression. And so you know, the challenges that artists have are, I guess, similar to the challenges that all people have, but yet unique in that they're triggered by the experiences of being an artist. So one of the things that you had actually kind of written down that I thought about a lot, because it's one of the things I hear a lot from artists that I don't hear from my non-artist patients, is that idea of tying your self-worth to your creative output, you know, and like, I'm only as valid as how good my last album was, or my last track, my last record, right? And that creates a tremendous amount of pressure psychologically on artists to produce, because they're not just producing to sell records or to express themselves because they enjoy expressing themselves. But often those who are struggling psychologically, it's because in some way they've tied their value as a human being to making that next piece of creative work. And man, that's a lot of pressure to go into a recording studio with. So a lot of the work then becomes about helping people create and helping artists really create music that inspires them, but at the same time, while being able to see that, if they never produced, you know, another piece of music in the rest of their life, like, they'd still be valid and worthwhile and okay as people. And that freedom that they get when they get to that place actually allows them to create great music. So that's sort of like the technical side of it. Anecdotally, where you're asking about sort of the starving, struggling artist piece, I think that's really interesting also, and it sort of takes me back to working with an artist who had a diagnosis of bipolar disorder. And so for those who aren't familiar, sort of, I guess you could call it like periods of mania, feeling on top of the world, being up all night, just really like, go, like almost like the internal psychological gas pedal is like slammed all the way down to the floor. And then those will alternate with periods of real crashes and feeling depressed and hopeless and worthless. And so this particular artist and people who have bipolar disorder, when not treated and not medicated specifically, which really is sort of the gold standard approaches to treating bipolar disorder and stabilizing mood, are almost all pharmaceutical in nature. People will end up hospitalized and can really put themselves in precarious situations that can jeopardize not only their stability, but almost like their survival. So it's very, very important for artists to sort of stay consistent if they're diagnosed bipolar with either their medication regimen or their therapy regimen or whatever they're doing. And this particular artist would basically continually go off their medication, because what they would say is, well, I write my best songs when I'm feeling completely manic or when I'm horribly depressed. Mm-hmm. And while on some level that might even be true for this person, it's like, man, there's a price to pay for that. And it's like, well, you want to create great music, but you want to be alive till 70 to do it, which requires learning how to maintain your health and your psychological well-being, while at the same time eventually learning how to touch elements of that manic place or that sad, dark place, even when you're in a fairly stable state, so that you can draw from that or from the memories of that to be able to create. And so it's almost like you can put yourself in that state for a moment when you're in your writing studio making music, without having to actually live in that state of suffering.
Well, I'm wondering, like, the whole idea of like a rock and roll martyr. I mean, anybody who's been a music fan kind of grew up on this music, and we've idolized all these musicians that were dead before they were 30 for whatever reason, drugs, suicide, what have you. So not to say that every single person who, goes into music and actually experiences some level of success is going to have that same frame of thinking. But I would say that happens once in a while, right? Like, people go into it thinking, I don't really care how long I live as long as I make great art. And of course, that would make your job all the more difficult.
Yeah, that is very much true. And, the funny thing is, you hear research on sort of people who have attempted suicide and unsuccessfully, right? I mean, we don't have much research on the feedback from the people that were successful, but those sort of who have attempted suicide and not succeeded, almost always describe that in those moments, right after the attempt, the most prominent feeling they feel is regret. Like, what did I just do? And all of a sudden, kind of the value of like, hey, I'd rather be alive, even if it's not perfect or I'm not where I want to be. And so I think sometimes, people that go into it thinking, and again, it's a delicate thing, so I want to be careful what I say, because I don't really truly know, and probably the experience of every artist, or certainly every person that's kind of in that martyr space, is very different than the experience of the person next to them that might be in a similar space. But that idea of going in and thinking like, well, I'm just going to do this until it ends and it doesn't matter when it ends, is probably because you sort of don't know what the experience of it ending feels like, right? And then as soon as you get there, it's like, maybe I don't want to go there. When I think about sort of the tragedies, and I mean, we could that list is a block long of, artists we've lost before their time, and who, we could all sit around and say, we know how wonderful the music they'd be making, and, be it Amy Winehouse or Chris Cornell. So Chris Cornell's actually one I think about a lot, because I was a huge fan of his music. I loved him in Soundgarden. I loved him in Audioslave. I loved his solo stuff. I had seen him in New York. I had seen him play in Toronto. I'd seen him actually about a year before his death, perform in an ancient Roman amphitheater in Caesarea in the Middle East. And it was, just him and a guitar with one backing musician. And it was truly one of the most powerful shows that I had, that it was haunting how beautiful it was. And I think about, the amount that him as an artist suffered, and in part suffered for his craft. And I mean, if you look at the content of a lot of the Soundgarden songs and, Pretty Noose, right? It was dark. I wish he was here so we could ask him. But I think my sense was when you look at someone like that, who was also like a family man, and so much of the content of his social media was, posting about his family and time with his kids, and, was a loving husband and a loving father and someone who did charity work and perhaps suffered a lot, which in the end led him to sort of go down the dark road that he went down. I don't know that he really wanted to give up sort of all that good in his life in order to kind of write another song and, sort of play another show. But yeah, really, I mean, tough things to talk about because, it's sort of like we're trying to sit and put ourselves in someone else's place of kind of ultimate darkness.
Mm-hmm. Yeah, I mean, and that was just one of many rock and roll suicides that we've had in the last, since the beginning of rock and roll, but really in the last couple of years. Or if not suicide, accidental overdose, right? Like we had Mac Miller just pass away a month ago. Have you ever counseled anybody that, obviously people who have had suicidal thoughts, but were really wrestling with that issue and coming dangerously close to, actually going through with it?
Sure. I think probably at every stage in my career, I've seen patients, who in one way or another had contemplated either fleetingly or very seriously taking their own life. It's probably the thing we take the most seriously in the world of psychology, and that in the end, above all else, my job is to keep people alive to the next therapy session, right? Mm-hmm. Happy, unhappy, it's like, I just want to get them there at least in one piece. And it's interesting, and if you look at the research on suicide and suicidality, there's almost sort of like two different streams. There are those whose suicidality and suicidal thoughts and maybe even attempt is built around a fundamental, pervasive feeling of hopelessness, right? They've, in a way, kind of given up on their life, and they don't see any hope of a better future, and they don't see any good in themselves or in the world or in what could be. And in some ways, by the way, those patients are actually the easier ones to treat because everybody's got hope and everybody's got the potential for some good in their life. You just have to help them recognize what that is and figure out, sort of what they had gone through and what dark or pain led them to this point where they had basically given up hope. So there's sort of that stream. And then the second stream are patients who haven't really fully thought it out. And in moments of acute pain, right, the pain is so significant that it's almost like an impulsive reaction to their anxiety of like, this pain I'm in is unbearable, I got to do something about it. And so they hadn't really thought it out for years in advance of I don't want to live, I don't want to live. It was just kind of like in this moment, like what I'm feeling is too much and I need to escape any way possible. And that's where you get things like those, almost like the accidental overdoses, where they might be in a tremendous amount of psychological or physical pain or emotional pain, depending on what's going on. And then it's like in that moment, it's just like, get me out of here, give me a bunch of pills, give me a bunch of Hennessy, whatever it is that sort of like numbs me out. And it's easy to just kind of slip over that edge. And those kind of situations are much more difficult because you can't really catch them in advance, right? Mm-hmm. So, I try to keep an eye and sort of predict who would be vulnerable to that. And what do I have to help them understand in advance to be mindful enough of their own behavior and to become aware of their own sort of pain and suffering level so that they can catch themselves as their acute pain is mounting in a moment and say, well, I'm walking towards that threshold. I need to sort of reach out for help or do something to kind of bring myself back and self-soothe in a healthy way, because otherwise the chances of actually being able to stop someone like that, well, nobody really sees it coming, right?
In terms of research and just working with patients, is it always kind of a given that you would be listening to their music at some point just to get a sort of a reference point and to look for sort of recurring issues that, that happen to come up in their lyrics, whether they're biographical or not,
Yeah, that's actually a great question. Because now that I think about it, in some ways that would be akin to, having a non-artist patient and sort of like going on their Facebook, right, to sort of look at and see like what are they posting, and as a clinician, right, I would never ever do that, right, sort of like respect that. I'll work with what information the client or the patient gives me rather than sort of going and seeking it out, even though it might be in the public domain. And so it is a gray area ethically, but I've always felt very uncomfortable as a therapist sort of doing that and going out and poking around and saying like, what is my patient posting? And so in some ways, I've had artists many, many times say, hey, here, listen to this. I just wrote this song. What do you think? Like, here's what I've been feeling. Here's what I've been thinking. But yeah, very seldom will I sort of uninvited go ahead and go through their catalog and say like, what's going on inside this person's head? How come they wrote that line? And then one of the interesting things, just to sort of like brighten the mood a little, because I know we've kind of gone to this dark place, which is fine. It's sort of pretty much what happens in my day to day. Some of the interesting things are, I actually had a great experience with an artist who I was working with who experienced really tremendous writer's block and was trying to complete a project and just kind of couldn't get it done, and the words weren't coming, and they'd go sit in the studio and sort of burning through their record label's money day after day and becoming more and more frustrated and couldn't kind of produce the music they wanted. And we'd sit in therapy and sort of talk about it and try and help them use a lot of sort of exercise and almost like psychological exercises to nurture their creative side a little bit and get that juices flowing. And then about a month later, sort of called me up and said like, hey doc, like check this shit out, and sent me the tracks of this sort of like album they had done. And it was basically like our therapy, like put into words, put it in and set to sort of like beats. And I was like, I like it. That's very novel. I don't know where you heard any of that stuff, but that sounds great. And
Did you ask for an album credit?
No, I asked actually not for an album credit. No, I'm kidding. I did not. So I will accept all album credits, but I typically I don't ever sort of push for it, in part because I don't want the artist to have to feel like they're compromising their confidentiality. Right.
Well, yeah, like you said, it was getting kind of dark there, and that's to be expected. I was bracing myself for that today. But let's try to move over to something a little bit lighter, and let's talk about your own sort of journey and walk with music, just as a listener, just as a fan. So growing up throughout the house, what were your parents playing? What kind of albums and artists were being played around the house?
God, I was dreading all of these questions. That specifically, like sort of that line of discussion. But I will tell you anyways, and I will give you the most candid and honest answers in the attempt to good, honest communication, which is what the foundations of good therapy are built on. So it's interesting. So my parents, my dad, born in 1955, and so kind of grew up as a child of kind of like late 60s and 70s music. And so when I was born in 79, it's actually funny. I think the week before I was born, I can't remember if it was Queen or Led Zeppelin, like they had gone to see sort of in New York, sort of like literally in the week before I was born. So in some ways, I actually grew up listening to really fucking cool music. I just happened to be in the womb during all that period. And so it was like Queen, Zeppelin, Boston, Aerosmith, like that was sort of all the music. And it was funny, it was really my dad who was kind of like a, long-haired guitar playing dude who was into that music, because when I had asked my mom this question earlier about, hey, do you remember what concert it was? She said, I think it was maybe Meatball. And I said, Meatball? You mean Meatloaf? And she was like, yeah, that's it. So yeah, it definitely wasn't her that kind of inspired the music around the house. So in my initial phases, sort of like at age 0, I think I had great musical influence. But then what happened was in my youth, I think my parents, again, like I said, I grew up in quite a religious, Orthodox Jewish environment. And, there was this consciousness about like the influence of secular music and its, bad messages about like, taking drugs and fucking and, all those things that sort of you can't really talk about in the Orthodox Jewish world. So mostly, so my dad, in his attempt to insulate me from that, had started a group of a children's music group with some buddies of his, which was like the children's equivalent to, I guess, the Jewish children's equivalent to like Sharon Lois and Bram. And so that was the shit that was playing in my house mostly while I grew up, which I was heckled for relentlessly as a kid, which meant that basically until I was about 13 or 14, had pretty much no exposure to decent music. So like 0 to 14 was just this like wasteland where it was like Uncle Moishy or bust, Yeah, so really kind of like a rough period for me. A little bit afterwards, when I went sort of to high school in New York, was kind of, and we're talking like early 90s, so like 92 to 96 were my high school years. So that was kind of when I started to get into real music for the first time. And it was kind of like, split the difference between 90s grunge and alternative. And so I was a big fan of bands like Pearl Jam and Nirvana and Green Day. Dookie was probably, one of the first like really seminal albums that I listened to 1,000 times. And then on the flip side, a lot of kind of the old hippie music. And so listening to, the Grateful Dead and Crosby, Stills, Nash and Young and The Who and Zeppelin and bands like that. And I think sort of I grew up basically skipping the 80s and listening to a lot of the music from the 70s and a lot of the music from the 90s.
Mm-hmm. And do you remember what was your first concert?
I do. So it's interesting, actually. It's funny because I, being that I work so much in the music world and that I'm such a huge fan of music, going to shows is pretty much what I do to stay sane for me. And so I'm probably I think this past week, I actually keep a log of all the shows that I attend on an average year. Yeah. Just like big ass spreadsheet with, sort of what the venue was and who I was there with. Mm-hmm. And I just hit my 56th show in 2018, right? And so we're about 9 months in. So I'm probably on pace for about 70 shows and, and about 3 or 4 festivals this year. But my first show ever was actually, so I was going to high school in New York City because I'd been kicked out of high school here in Toronto out of this sort of like Jewish parochial school. And I was in 10th grade, so it would have been 1994. And I went to see The Offspring at Roseland Ballroom. And I was one of those kids who was sort of like this like grunge kid. I think I was wearing a t-shirt, one of those really tight t-shirts that had like the logo of some old cereal on it. It was like a Golden Grahams t-shirt and some, sort of like tight jeans with kind of like a flared bottom that were all ripped up and Airwalk shoes. And I remember just kind of like sitting downstairs in Roseland. There's sort of this like downstairs loungy area that was it dingy, and just kind of like smoking cigarettes down there and thinking I was such a badass, and then going up to hear them play Come Out and Play and Keep Them Separated.
Have you ever made a mixtape for anyone? Mixtape, mix CD?
So the answer is definitely yes, and I was thinking about it, because of the title of the podcast. I sort of knew this question was coming, and I was like, fuck, I can't remember a single song that I had put on a mixtape. I remember making tons of them because, part of being sort of like an angsty, grunge kid in the 90s was, I guess that was sort of like the pre-version of like emo was, I was like in love with every girl and constantly trying to like win people's hearts and constantly getting rejected, which in the end basically just, sort of inspired me to listen to more painful music. And, it sort of this like self-perpetuating cycle. And oh man, I made mixtapes for girls like a fiend. But I guess in part because none of them ever worked out to actually get the girl. I don't remember ever what I put on them.
One thing I want to bring up with you is this book, and I'm sure you've read it or at least heard of it. This is Your Brain on Music, and there's a subtitle to that, but it's from the author escapes me right now, but I know that he is a doctor of psychology at McGill, and it really just kind of explains sort of the science behind music. So why does a melody get trapped in your head, and why do we sort of gravitate towards certain voices more than others? Things like that. I know that's not your specialty, but I'm sure this is something that you've kind of come across in your own studies. Let's start with that, if you could. Why does a melody get trapped in our head? What's the science behind that?
Sure. No, and that's it's an interesting question to think about. And I think while the neuroscientific perspective, which is kind of what you get in that book, is all spot on and sort of empirical and based in tons and tons of research. To me, the part that's always interesting is kind of like the more psychological, the emotional component of that. Which, if you looked at that from the softer science side of psychology, you would say it might contain two things, which is on some level, our relationship with music is context dependent, which means that when we're in a depressed mood, we have a tendency to listen to music that actually perpetuates that depressed mood, right? And when we're in sort of a euthymic or positive mood, we have a tendency to listen to music that perpetuates that mood. And so it's almost like sometimes a good barometer of like trying to know where you're at is looking at like, what is the music I'm listening to right now, right? And if all of the music I'm listening to is sort of angry, but if someone said, hey, are you angry? Like, you'd be like, no, totally not. Well, then it's like, you got to wonder, like, why am I listening to all that music right now, right? Is there something I'm kind of not letting myself deal with internally? So there is sort of the context, I guess, matters in affecting the type of music that we might be drawn to in a given moment. And then the other thing, which, of course, we all know this, but I think in some ways, maybe this is part of the beauty of music is that it's association, right? The associative properties and, how closely a song is connected, even if we don't recognize it consciously in a given moment, how closely a song is connected to all of the memories we've built around that song and all of the previous times we've listened to it and the context in which and who we were with and what was going on in our life at the time. And, there are definitely certain songs that when I hear them now really like kind of bring me back to a different time and kind of remind me of what I was going through then. I think about it, one of my favorite acts in the world is Bon Iver. And just a quick shout out to John Hulley and Reggie Pace on the trombone, my good buds who play with Justin. And listening to that first Bon Iver album was something that I guess I discovered during a really painful emotional time in my life. And sort of whenever I feel vulnerable like that, I tend to go back to that music. And it sort of brings me back right to that place and all of those memories that, listening to Flume and Skinny Love and those songs just kind of take me right back there. And so I think in some ways, the music that affects us is also really connected to all of the associations, be it smells, memories, the characters we were with that are connected to those pieces of music.
Mm-hmm. Well, is there a single song or album that you cannot listen to anymore because it just destroys you inside, like just associated with a bad breakup or a friend passing away or anything like that?
That's a great question. Let me think about that for a sec. It's funny, and I have this sort of, I don't know if it's true or not, but I've always thought, I guess it's sort of the romantic in me that every person goes through kind of like one ultimate horrible breakup in their lifetime that's like significantly, measurably worse than all other breakups. Mm-hmm. And, and I had that sort of whole bunch of years ago. And it's funny because there wasn't like a particular song, but what's interesting is, and again, at the risk of sounding a little trite, right? So I've always been a huge fan of the Dave Matthews Band. And I had taken sort of this girl with me to a bunch of his concerts. And, I'd probably seen him 50 or 60 times before I had ever met her. And then over the years had taken her to a bunch of shows. And after that ended, there was a real good long time where it was just like, I'd still go to the shows because all my buddies were going and I knew people on the crew and was just kind of hanging out. But like every time he played Crash Into Me, I'd just have to sort of get up and go to the bathroom or go get a beer and just like kind of couldn't sit in the arena and listen to it. It was just sort of too much. But eventually over time, I think one of the beautiful things about the human brain and the human psyche is, well, in the same way that, sort of we create those really powerful associations, we also have the potential to create new associations, right? Which is kind of how we heal from things like trauma. And so over time, sort of like built a different relationship with that song and that band, and was able to go back and listen to all those songs and not sort of think about the pain of that breakup, but think about all the other things that I had now kind of associated with that. And, sort of in my mind, it's funny, still that one song when he sort of plays Crash, it's almost like, I think as a defense mechanism, I just immediately picture, it's sort of like the chords of that song are kind of complex to finger, and you've got to stretch your hand across like 5 frets. And so I'll just sort of like picture what it would feel like to stretch my hand across those 5 frets in that moment, instead of sort of like getting into the deep nuances of like the pain of, sort of what the lyrical content is at that moment.
So that's almost time for us. But before you go, I have to ask you, Kanye West, if you were his psychologist, what, I know this would actually take hours and hours and hours of counseling, but just on the surface level, what we've seen in headlines, and I know that's not entirely fair, but everything that you've seen outside of his music, his persona, some of the interviews, what's happening with Kanye?
Well, first of all, I can neither confirm nor deny that I've ever treated Kanye West.
Oh, okay.
No, I'm kidding. But it's a good question. In some ways, I think people often underestimate the intelligence and the thoughtfulness of artists and moguls. Like, you kind of don't get to where Kanye West got, sort of doing things impulsively and accidentally. And I think probably a lot of his behavior and dialogue might be a little more instrumental and sort of with intention and an agenda than perhaps we think.
I think so, yeah.
Yeah, so I think that's probably a safe bet to say, and and people like that, while in the end they might be sort of the alpha dog of their world, but man, there's a lot of handlers around them sort of pushing and influencing and guiding, and all those people will kind of try to influence the direction. And if they thought that something was really going to be damaging to him personally or to his career, probably would be mitigating a lot of what you see being allowed to kind of happen. But that being said, on a mental health level, it's interesting. There was an old theory in psychology that human beings are driven to 3 things, which is affiliation, right? We want to feel sort of connected to others, and so sometimes we say things to try and establish a connection with others. B, agency, right? Which is to feel like we have some sort of ability to impact the world. And even if that impact comes through kind of shock value, right? Well, at least we know that what we're doing is sort of people are noticing, right? Mm-hmm. And then the third drive is the drive to autonomy, to be able to really exert our independence and freedom, and sort of I can be my own person in the world. And I think with Kanye, you see sort of a lot of those, that real powerful drive to like, I want to do my thing and say what I'm going to say. And, not only it doesn't sort of matter if it's different than everyone else, but like I kind of want it to be different than everyone else. And I'm going to sort of push that envelope, which in part is what makes artists great, right? Mm-hmm. Is those artists who are willing to be autonomous and not sort of follow the mold. And that's what's always allowed the music world and the music itself to progress. And I think Kanye is a really good model of someone who's kind of driven by that autonomy.
Yeah, not playing it safe and kind of willing to be contrarian if he wants. Right?
Exactly.
Yeah.
Well, thank you so much for being on the show this week. And if people want to check out your work, if they're interested in taking you on as a doctor, where can they find you?
So the best way is actually probably via the internet. Mm-hmm. Surprise, surprise. And they can find me at, it's Dr. Chayim Newman. So that's DrChayimNewman.com. But guys, yeah, really an honor and a pleasure to be here, and just think any chance to talk about artists, which, I should say one thing, which is in part the reason why I do this, probably above all other things. And I always tell this to artists, is that for me, what's therapeutic is listening to the music. And this is in some ways the opportunity for me to give back to those who end up taking care of me and my suffering. And So I do very much enjoy talking about it, and I really appreciate your guys' love of music and your caring about artists. And yeah, really just a pleasure to be here. And so thanks for having me.
Thank you.
Thank you. You've been listening to Season 2, Episode 21 of This Broken Mixtape with psychologist Dr. Chayim Newman. If you haven't already, visit thisbrokenmixtape.com to check out this episode's Spotify playlist. There you'll also find our past interviews and custom illustrations for each show. If you enjoy this episode, please take the time to subscribe, rate, and share our podcast wherever you're tuning into us today. Also, if you have any comments, feedback, or ideas for guests, feel free to drop us a line through our website, Instagram, or Twitter. You can find all our episodes on iTunes, Stitcher, Google Play, the Buns Podcast Network, YouTube, and now Spotify. Join us back next week for our interview with Saddle Creek Records singer-songwriter Sam Evian. As always, thank you for listening. We really appreciate it. Cheers.